The aim of the study was to find out what midwives in the public antenatal setting in Australia currently think about both maternal and childhood vaccines, and how they currently talk about them and how it fits into their role to recommend those vaccines. And we also wanted to know what resources they currently use and what they'd like to have to support those conversations. The study found that most of the midwives we talked to were, all of the midwives were supportive of vaccination, and some of them felt that it was really an important part of their role to recommend vaccines, while others thought it was more routine or a more minor part of their role. This was a small qualitative study, which means we interviewed midwives at the Royal Women's Hospital in Melbourne and at the King Edward Memorial Hospital in Perth. It sort of varied from person to person in terms of how confident they felt talking about vaccines, but certainly overall they felt like they didn't have a lot of resources about vaccine safety and effectiveness, and they didn't have a lot of detail, particularly about childhood vaccines, which they could quickly and easily communicate with parents. They definitely felt that there were some resources, but none that really were as detailed as some parents were looking for. Some of the midwives we spoke to said that it would be helpful to have a training program or a training day. Others felt that an app or a website that they could share with parents would save them time and would be easy for them to use. So at the moment, they pretty much across the board said that in their undergraduate degrees, they didn't receive a lot of training about vaccines, especially not about childhood vaccines. A few of them had done additional training to become nurse immunizers, but that wasn't that common. Recent research shows that midwives are among the most highly trusted and highly accessed sources of information about vaccines for expectant parents in the Australian public antenatal setting. Well, we know that vaccines are the best way to protect children against a number of very serious and potentially deadly vaccine-preventable diseases. Well, expectant parents actually start to think about what they're going to do in terms of vaccinating their children while they're still pregnant. And so midwives have a really important role in providing positive information and recommendations towards childhood vaccines even before the child is born. Some parents who have concerns about vaccine safety really want a lot more detail about the safety studies that have been conducted. So it certainly is helpful for us to provide sources of peer-reviewed information rather than blanket statements about safety. But we also know that messaging coming from a trusted healthcare provider is the best way to reassure parents about vaccine safety and effectiveness.